Hey everyone, Medicare program that promotes rural health care delivery, 381.5 million in net savings, and that's a good thing. And so this is another article about accountable care organization, and they're also talking about the investment model known as AIM. Okay, let me read the first few. This is a short article, but I'll give you the gist here. So this a new study by Apt Associates, which is a global consulting firm and partners, published in Health Affairs, found that a program to support rural healthcare providers resulted in 381.5 million in net savings for Medicare. The savings accrued over 3 years, and primarily driven by decreases in hospitalization and other institutional care services. This study expands on the findings from the evaluation of the Accountable Care Organization investment model, also known as AIM. So even though it's an ACO, this model is called AIM, to improve health care delivery in rural and underserved areas while maintaining quality care for patients. ACOs are groups of physicians, hospitals, and other healthcare providers that participate in Medicare's Shared Savings Program, also known as MSSP. Under AIM, ACOs receive upfront payments that were recouped from later savings shared by the ACOs in Medicare. Sorry, I got stumbled there. Okay, but downside risk needs to be addressed. And so while Medicare, the participating care providers, patients, and benefit from AIM, nearly 2/3 of the 41 AIM ACOs exited the program at the end of the 3-year term. Continuing the shared savings program would have required the ACOs to take on the downside risk, and so the potential for financial loss in addition to receiving the upfront payments. So many ACOs cited that cited this requirement as a reason for exiting. App study found no difference in exiting and estimated savings provided by the exiting ACOs versus the remaining ACOs. These findings, coupled with a large net savings to Medicare attributable to the model even before ACOs would take on the downside risk, suggests that the instant on including downside risk for ACOs may substantially reduce opportunities for Medicare to save money. And so overall, I'll just read a little bit more. It's a short article. Overall, the AIM has had mixed success. On the other hand, the reduction in total Medicare spending was substantial and greater than in earlier similar models. On the other hand, the upfront investment on AIM ACOs were not sufficient to maintain participation in the face of downside risk, even if they succeeded in encouraging ACO participation in more rural and underserved markets. Implementation of CMS's chart. So CMS is the Centers for Medicare and Medicaid Services, recently announced Community Health Access and Rural Transformation model. So this is obviously not under the Medicare Shared Savings Program. This is directly under the actual federal government program or government entity known as CMS. Okay, model in which there are two tracks: a hospital-focused model and an ACO transformational model similar to AIM, are meant to help stabilize hospital revenue in rural areas. Our findings from the AIM evaluation have several implications for chart. First, the policymaker may find it advantageous to allow rural providers in the ACO transformation track to pursue a slower path to taking on downside risk. This could promote sustained participation, which may potentially yield greater long-term savings to Medicare. Okay, second, although preventing unnecessary hospital and skilled nursing facility stays is good for beneficiaries, these efforts are associated with reductions in Medicare revenue for rural inpatient facilities. This reduction in services may be exacerbated. Financial stresses on facilities potentially contribute to additional closures and further reduce access to care providers in underserved areas. Our findings suggest that policymakers should carefully consider the amount of Medicare savings to retain for Medicare and the amount to be reinvested to sustain providers in underserved areas. At a high level, the significant savings tell us ACOs can succeed without downside risk, says Matt Trumbley of APP's lead investigator. The question to be answered in subsequent models like CHART is whether Medicare can find the right balance to continue encouraging and maintaining ACO participation, because in those first 3 years, everyone is benefiting. So that's really good insight there, I think, to be able to provide care, extend care to rural areas with these aims or charts. ACOs, and be able to have the providers not face downside risks. So that is definitely the big question, and that's why I guess more ACOs are ACOs exit because of that downside risk, which is, fair. It's like doing business, and I think CMS is not wanting to spend tax dollars just without knowing more about different models that could potentially provide more access to care. Okay, so this is just about App Associates. App Associates is a global consulting and research firm that combines data and bold thinking to improve the quality of people's lives. And so I'll just end it right there. But yeah, that is definitely good insight. ACOs continue to save Medicare money. Now, this is a net savings for rural healthcare. I've got other videos about ACOs if you want to look into it. I'm going to do an ACO playlist if you're interested in that type of thing, or if you have questions about Medicare shared savings programs, please let me know. And this is for you healthcare providers out there that are looking to maybe start an ACO. I just know that there's been year after year more and more news about ACOs saving Medicare money. And here at Medicare Savings, yes, I do want to help the beneficiaries individually, but as a community, I would love to know your thoughts about saving Medicare, the actual federal government, some of your tax dollars that you paid into, and then also just making sure that you are informed if you're watching this. So thanks so much for listening. Take care and God bless.